My title today is Director of Clinical Product Strategy at Clearsense. I've been at Clearsense for a little over 3 years. I was initially hired as an account executive, portfolio director role, where I work directly with our clients that have our products within their IT space in healthcare, and also oversaw the clinical quality team. I recently was brought over to the technology side of the house. I had almost 22 years of healthcare experience, with more than half of that being in health IT. I work directly with our developers, our data engineering team, anyone that really stands behind our product to develop and make it a better product for the healthcare world and space. I've been doing this with them for about 4 months now, and I'm really enjoying it. I started nursing a little later in life. I was in my mid to late 20s when I realized I needed a career change and really wanted to focus on what core to my values, and that's really helping people. I became an ER nurse and was a bedside nurse for a little over 10 years in a hospital outside of Boston. In that time, not only was I at the bedside, but I was a nurse leader as a nurse manager of the emergency department. Part of what we do as a health IT data platform, enablement platform, is that we archive legacy data. So a lot of health systems are moving to larger EMR like Epic or Cerner. And so they have all of these legacy systems that they need to do something with. They can't just get rid of them. There's healthcare data, there's retention policy that they have to follow. It's also patient information for continuity of care. We need this as clinicians at the bedside to be able to look back and see different records of the patient, results, etc. One of the pieces to that is mapping the documentation to a standardized document tree. And when I started here at Clearsense, we didn't have a standard template that was across the platform for all of our clients. One of my challenges was to standardize the document tree, but also make it so that on the back end, it maps to standard terminology. So FHIR, HL7, all that helps us really bring that data in, and we can do something with it besides just using it for an archive purpose. What I did is took the current document tree that we had, which was across all clients, very different for each client. I broke it down into the basic needs that as a clinician or an HIM team member to be able to find it quickly and have it make sense to an end user from a clinical workflow perspective. Updated the document tree. I minimized it to not have so many selections to try to find the information, and really narrowed it down based on care delivery and clinical workflow. So we went from having about a document tree that was over 300 lines to about 150. Technology is there to serve us as clinicians, to help us deliver patient quality centered care. While a lot of the team members thought that because we had our document trees and they already existed, to go back to a standard nomenclature or structure would not be possible. I believed that it was. My leadership believed that it was. We were able to do that, introduced it to our first client when they were going with some new work streams, and they accepted it with no changes. And we moved forward with this standardized document tree, moving with all of our other clients. I started off with fellow colleagues. So we do have a team of clinical quality analysts that I work with on a day-to-day basis already. We sat down together and looked at what we currently have. We came to the table with our own ideas of how we would want to build out the document tree. And then we did use AI to help plug in our ideas to see, how does this fit? So the first client we gave it to, they literally approved it within that same call. They were pleased to know that it was based on industry standard, as well as that we had worked on it internally and other clinicians had been reviewing it with me. The idea behind the document tree was to build it in such a way that there wouldn't need to be a lot of training on the product once it was rolled out. So if I'm a clinician and I go in and I have to look up a patient record and I look in our report summary for the UI, it makes sense to me. While we do a train the trainer for our customers, our clients, it's in such a way that they can rapidly turn around and train their end users and not have to spend a lot of time doing that. I think it would be to remain curious. When I was in nursing, initially, we documented on paper, and I was an ER nurse, so you had to do it rapidly and you had to be able to get to your patient because typically they were coming in on an emergency, they were under duress. When we were told that we were going to have to start to use a computer to document and to track patient record, I was a naysayer, and I actually was almost kicked out of one of the classrooms. I was resisting that change because there was fear behind it. I didn't understand technology. I didn't use technology. So I would tell my younger self to remain curious, to speak up, and most importantly is never lose sight about the patient, that no matter how difficult things become, if we keep the patient at the center of what we're doing, we'll always be headed in the right direction. I think every nurse has a moment where they made a mistake. They misinterpreted something that was written. I had a patient that while they weren't under an emergency from a life-threatening standpoint, they were in significant pain. I was quickly wanting to give this patient medication. I got a verbal order, and then when it was documented by the physician later on, the verbal order that I heard and what I gave wasn't what was written, plus what was written was inaccurate. The patient did fine. There was no event. It was just a slight larger dose than what they should have gotten. What this taught me was that if we had better quality checks behind orders, specifically patient safety would improve. So I joined the technology bandwagon, as we like to call it in healthcare, because I felt that I could help improve it by being a voice. Since I've been a clinician and technology was coming into healthcare no matter what, I felt that being that voice behind helping with technology grow would be important, and then I would be able to better the environment when it comes to shaping technology, which would improve policy and overall help with healthcare delivery. I would like to see more nurses at the decision tables. I would like to see more nurses driving policy, driving the technology and the intuition that we need behind it in order to deliver that care. Nurses are the core of patient care. While we don't have a medical degree from a doctor standpoint, we're taught to care for our patients holistically. And that's not only treating them for whatever illness they have and what they're going through, but it's also to think about them as a whole person, as well as their family, as well as once they leave, their social determinants of health. That's where nursing makes the most impact. So I think through healthcare, through decision-making, having more nurses at the table to drive policy, to drive strategy, to make those big decisions is important, because we're the center of care, as I like to describe it. Nurses are at the heart of healthcare, but what we do often happens quietly. We're not the doctor that saved the life necessarily. We're the ones that execute on the provider orders and physician orders. So I think that it's important to recognize the nursing, because recognition fuels our resilience. It makes us feel empowered to be at the table to help make those decisions. I think it's important that we do things like this. When I was nominated for this award, it hit me really hard in the heart and made me realize that while I don't touch a patient and care for them on a day-to-day basis, what I do with my company at Clearsense and my leadership sees this, that they believe in me, and I know in the long run this is impacting patient care and still continues to help our patients. I think being able to tell my story, it's funny because when people ask me, well, what do you do for work? And I say, well, I'm a nurse, but I work in IT. And they're like, they scratch their heads. They're like, what? So I think having more broader awards within the nursing world that not only recognize that nurse that's at the bedside delivering such important care to our patients, but as well as recognizing that there are nurses in other fields like IT. To me, this alone, just being interviewed, knowing that you're looking at nursing outside of just the idea of healthcare delivery at the bedside and thinking about all the other careers that nursing can have within healthcare is really important.